towards meaningful and I'm Dr. Azaz Ahmad Khan, and I have the pleasure of moderating this session. We are thrilled to have the diverse participants from all over the world joining this session. It's my absolute pleasure to introduce today's distinguished speaker, Dr. Naveed Yusuf. Dr. Yusuf is CEO of Aga Khan University Examination Board and Chair Associate Professor of Practice in Education Development at the Faculty of the Health Sciences, Aga Khan University. With a career spanning over 15 years at Aga Khan, Dr. Yusuf has led several innovations in education assessment and has been recognized nationally and internationally, including the Royal College of General Practitioners and International Association of Education Assessment. His scholarly work in psychometrics and standard setting, along with his awards in innovation and teaching excellence, make him the perfect voice to guide us through today's session. Dr. Naveed Yusuf, thank you for joining us. The floor is all yours.
Thank you so much, Azaz, and of course, Professor Dr. Sara Khalid and co-teach for inviting me to speak to this gathering. It is a pleasure, and I hope we all will learn from each other during this session. Let me share my presentation, and we may then begin. Please let me know if the slides are available on the screen.
Yes, sir.
Thank you. So we all know that the title is Assessment Reimagined Towards Meaningful Modern Measures. Before we begin, let us start with getting to know each other. So I also get to know from where you all are attending. I will give you certain tasks. We know that there is a large number of participants attending today. So what I would like you to do is to just type in your city and country in the chat box so that I get to know the diversity. City and country in the chat box, please. Mhm. The first three, Egypt, Pakistan, and Malaysia, shows the diversity. India, fourth. Right. Thank you. So I've got another screen open with me. If you have any questions or comments, even during the presentation, feel free to type it in the chat box. I will try and keep an eye and respond if possible during the presentation. Okay. We have Kuwait, um, quite a few participants from India, many from Pakistan, at least a couple from Egypt, and different cities, of course, in Pakistan and India. Of course, I see Malaysia now. Thank you for this. So your next task is to type in the name of your medical college in the chat box, please. Mm-hmm. Interesting. Of course. A few names I'm aware of, and of course, there are others which I'm getting to know today. So thank you for this introduction as well. And to get to know you even better, please also let me know if you work for undergraduate medical education, postgraduate medical education, or if you are responsible for both, type both. Very quick responses. I am so glad. Many are responding with both. I see quite many UGMEs and a few postgraduates. I hope that this session will be relevant to faculty members and leaders responsible for both undergraduate and postgraduate. Very interesting mix, very diverse attendance, and the discipline or the department you represent today. in the chat box. Uh-huh. Of course, many medical educations and DMEs. I also see community medicine, orthodontics, surgery, biochemistry, forensic medicine. Welcome. Of course, Dr. Hasnain. Thank you for attending this. I've been learning a lot from your webinars and sessions. Right, we've got pediatric nursing, so we have colleagues from nursing as well. We have faculty from pharmacology, rehabilitation. So glad to know the diversity. And even during the presentation, I will be asking questions. We'll try and keep it interactive. Since there is a large number of participants attending, responding on the microphone can become chaotic. So I will request whenever I ask questions, feel free to type in the chat box. And even if you have any questions or comments, I will keep an eye to look at your questions and comments and try and respond as we go along during the presentation. So the outline for today, we will talk about what assessment is and what is good assessment. We will talk about the common gaps in student assessment practices. We will talk about my dream, assessment reimagined. So I'm thankful to Core Teach and Dr. Sara, who forced me to reimagine assessment and dream about an ideal assessment. And then we will also talk about practical steps towards the reimagined assessment or to make the dream a reality. Let's first talk about assessment. The other request I have for you is please feel free or please continue to reflect on what we discussed during the presentation. Think about your assessments, the assessment plans or assessment practices you are engaged in, the assessment practices that are being followed in your institution for your programs and courses, and keep on thinking as to how you can improve. What are the gaps? What are the good practices? If you believe there are certain things you are doing which we all should learn, feel free to type it in the chat box to share certain good practices. And more importantly, continue to reflect as to what each one of us can go back and improve upon, even small steps, but to move towards an ideal assessment plan or program. Okay, let's to begin focus on the process of assessment. What is assessment? What do we do? Or what is expected of us when we are engaged in assessing our students? We observe their performance or behavior, whether it be written through their MCQ choices, the choices they make on an MCQ exam, through their short answer and long essay questions, through their responses in an oral exam, through their performances during OSCEs, objective structured clinical examinations, or during workplace-based assessments, or during laboratory performances, or in your simulation centers, we observe. We observe their performance and we observe their behavior. This is the first step. And the expectation is that these performances and behaviors, the tasks have already been identified and defined. For example, clinical examination, for example, if you're observing clinical performance, that competence or that task has already been defined in your curriculum as your learning objective, right? And we will talk in detail about this later as well. The second step is you evaluate the performance or make a judgment as to what kind of performance or behavior was it against the expectation. Was it very good? Was it good? Was it outstanding? Was it 5 out of 7 on a rating scale? Was it not done or partially done on a checklist? Or was it a 6 out of 10 using a marking criteria or scoring criteria? These kinds of judgments are made. The third step, we record and report our judgments. And the fourth step, which is at many times missed and is an expectation when we do student assessments, is to provide feedback. So the last step of student assessment should be providing feedback to all stakeholders. Of course, providing feedback to your learners or students, providing feedback to your faculty members on the performance of the students, if they learned well or they lacked on certain learning outcomes or objectives, giving feedback to curriculum developers, and giving feedback to your examiners and exam developers. This is how you complete, of course, the curricular cycle. However, you also complete the student assessment process. And that is the first thing I believe I want you all to reflect on. Are we really completing the student assessment cycle? Are we really providing feedback to our students, not only after formative assessments, but also after summative assessments? Let's proceed. Also, let's start with our goal or objective. Why do we all exist? Why do these programs, these curricula, these institutions exist? Why do we have student assessments in the first place? Because the goal for us in health professions education, be you belong to medical education or nursing or pharmaceutical, our goal is to ensure that the graduates should demonstrate competence. The graduates should be competent in what they are expected to do. Now, my question to you is, what do you understand of the term competence? Please feel free to type your answers in the chat box. What do you think is competence? Waiting for your answers. Any volunteers?
Ability to perform a specific task.
Mm-hmm. And now we have responses in the chat box. Knowledge, skills, and attitudes to practice medicine safely. Thank you. I completely agree. Demonstrated ability. Very good. Short and sweet. I like it. 2 or more domains. Yes. Learning domains, if you're talking about ability to perform, capability. Very interesting. Verifiable, accessible ability. Good concept, Dr. Lai. Thank you for attending the webinar. Ability to perform. So what we see, the key words are ability, capability to perform, right? Or being competent. So competence itself is a very heavy term. And in assessment terms and in education terms, we call it a construct, a very complex construct. And when I looked at the literature, competence is explained as the range of abilities. And most of you were very, very correct. It is the ability. So competence is defined as the range of abilities that enable your students to perform all required tasks to practice effectively and consistently. From your professions, from your programs, can you list at least one or a few tasks you would want your graduates to perform in the chat box, please? What kind of tasks are we talking about here? Communication skills, thank you very much. Very, very important. Health education to public. Wow, I am so glad we are starting with very important tasks or competencies or outcomes we don't frequently assess. Research, yes, very good. Catheterization, being advocates, I agree. Infection control, diagnosing problems or diseases, collaboration, leadership, professionalism, being ethical, providing feedback. Thank you, Dr. Sarah. Very important. Their clinical skills, yes. Clinical reasoning. And now I want you all to look at this task in the chat box and reflect. Do we really ensure that our graduates are competent in these tasks or competencies? Do we really assess our graduates enough to be sure that they are competent in these competencies? And yes, digital competencies is a new emerging. I agree with the person who has given this a thumbs up. Yes. I know, not really. And this is what I want us to all to reflect, because the title is Assessment Reimagined, and the title is Multiple Measures, right? And to think about, let us now ponder today as to what are the different measures we should be assessing and we are not. Yes, I'm so glad that we have realized this at this stage, Dr. Lake. Hardly ever. Thank you for this. I really love this response. Okay. And these tasks we know are known as outcomes or competencies. And we know that there are quite a few, at least, international models of competencies or outcomes. What I bring today are two, one from undergraduate education from Pakistan Medical and Dental Council. They call it a 7-star doctor, and they have listed these 7 competencies. I show you on the screen that the graduates should be skillful, knowledgeable, community health promoters, critical thinkers, professionals and role models, researchers and leaders. And I also bring to you one example from Pakistan, the model from College of Physicians and Surgeons Pakistan. That's the postgraduate competency model. And here we see many common competencies or attributes or outcomes, and a few more. For example, being advocates, right? Professionalism and research is common in a way. Patient care is common. We check only 2. Yes, I I agree. Or I would say we only check knowledge and knowledge and knowledge and knowledge and knowledge, and yes, sometimes skills. At many institutions, for many programs, for many courses, I mean. And I know that there are quite a few programs and institutions, at least, who are doing a good job or a better job. Also, let us reflect upon, and I know this is known to everybody, on the good assessment practices. We talk about valid assessments and we talk about reliable scores and decisions, right? Are we measuring what we wanted to measure? And are we measuring with precision? Are our assessment decisions and outcomes, which are pass and fail, promotion and no promotion, going for remediation or not, certified or not, giving a licensure or no, all these decisions ideally should be valid and reliable. If I may ask you to elaborate on in the chat box, what do you further understand about validity? Let's ponder about what is validity. Waiting for your responses. Okay, these are types, content, validity, and construct. It is a measure of what you really want to measure. Thank you, Dr. Mona. And we have just listed what we want to measure, right? Testing what we are supposed to test, yes. And now reflect on the list we have just talked about. We have talked about communication skills. We have talked about professionalism. People wrote attitudes and behaviors which come under professionalism. We talked about research, ability to measure correctly, okay, accurately, yes. What is meant to be measured? What is identified as learning outcomes or learning objectives or competency? Evidence provided to support or refute the interpretations assigned to the scores or to our decisions. Thank you, Dr. Ruxana. Yes, Dr. Aisha. Are your assessment appropriate for the competencies you want to measure? And now let's focus on reliability. What do we understand by the term reliability in the chat box, please? Let's focus now briefly on reliability. Reproducibility. Yes, very commonly, reliability is also termed as reproducibility or defined as reproducibility. Dr. Humaira, precision, I agree. Would anybody want to elaborate on reproducibility or precision? Dr. Sadaf, yes, when repeated, it gives the same results. I agree. This is the the definition. Suleiman says consistency. Standardization, Dr. Ibrahim, yes, standardization contributes towards reliability. The trust on results, yes. Do we obtain the same results if we repeat the same test again and again? Mm-hmm. Dependableness, yes, Dr. Atia, I agree. Thank you. Thank you for your responses. So I have been waiting for the term error in your responses. So high reliability means you have measured with precision. If you will measure multiple times, you will get same or similar outcomes or measures or results because there was less error. So high reliability means low error, and low reliability means high error in your decisions or scores. And there are different sources of error. I also wanted us to think about sources of errors. There are errors based on your examiners because they are not trained to be the raters or develop the examination. There are errors based on that the task or the questions or items are not clear, or the scoring criteria or your marking schemes are not very objective, they are not very clear, they are not structured correctly, or they are not aligned to the task. Sometimes the patient does not behave appropriately, specifically the simulated patients or the patients used for OSCEs or clinical exams. Logistical errors may also contribute to errors in your decisions. The instruments not working properly, the gadgets not available for the exam, if they should be available, the environment not being conducive, or the examinee, your learner, not ready for the exam. They do not know what to expect, how to perform. For example, if your learners are undertaking an OSCE exam for the first time, and if they do not know the rules of the game, if they do not know they have to read the task first, if they do not know it will be a timed station and they have to move clockwise or anti-clockwise, it will just introduce error, not because their scores will go down, not because they didn't know the task, only because they didn't know the rules of the game. They didn't know how to perform in an exam. Not because they were not able or capable, however, because They didn't know what to expect in an examination. So these are the different sources of error we have to take care of. How can we promote reliability? We have talked about objectivity. We also talked about rater training, and someone I read wrote standardization. Let me ask you quickly, what do you understand by the term objectivity in the chat box, please? I agree with you, Dr. Suleiman. Uh, yes, Dr. Mona. Objectivity is assessing according to a checklist or a rubric, presence of a clear, agreed upon answer or criteria. Thank you, Dr. Khalid. Understood same by all. Yes. Your scoring criteria or your marking scheme should be understood by all markers or raters. Lack of bias, judgment, or prejudice. Completely agreed, Dr. Atia. Only because you will have the scoring criteria or the rating scale available with your raters. To control human errors, yes, to reduce biasness, to reduce your personal choices and decision making. It should be verifiable, yes, because your decisions or your scores will be against a written, agreed upon criteria. And that is why it has to be specific, standardized, yes. To an extent, yes. So I hope now we have understood what is objectivity. If you have any questions, feel free to type it in the chat box. We all know that rater training is important. If I may now ask you, what do you understand by the term standardization? Dr. Sara, you used the term standardized. What is standardization? Waiting for your answers. What do you understand by standardization in terms of student assessments? Certain norms agreed upon by the faculty or the quality assurance. Interesting. To try in other settings also. Conformity. I agree. I like this term, Dr. Suleiman. Conformity. Process of establishing a standard for uniformity. Very nice, Sabha. Agreed upon standards may or may not be organized and regulated very close at the criteria. Okay. Pass fail criteria, Syra, no. That's standard setting. Setting a pass fail criteria is standard setting. That's not standardization. Suleiman, Dr. Suleiman, Sadiq, yes, uniform procedure. That I would say is the correct explanation. That your treatment to your students is similar across all students. They all give same or similar exam, same or similar difficulty exam, in a same or similar environment and opportunity. It is very close to be fair and consistent and comparable across all test takers. Very good, Maha. That is exactly what standardization means. So standardization is when you administer your exam, you treat all your learners or all your candidates same or similarly at least. Objectivity is when you score, you have a criteria, so you score all of them using the same or similar scoring criteria. Can we call it systematic? I believe yes, to an extent, Mavish. Very close to being systematic, yes. A lot of overlap, I would say, at least, if not the same. And I think many of you at least have been writing that for reliability, we should have multiple observations using multiple assessments and probably assessment methods, using multiple assessors in multiple contexts. For example, your inpatients and outpatients, in the wards and in simulation centers, in community settings, maybe, in emergency settings, in ORs, and so on. So, whatever competencies we have been talking about, now think of those competencies and think of making multiple observations, multiple assessments, using multiple assessors, and in multiple contexts. This is your task to reflect. And as to how much, to what extent do we really do this? Even for our knowledge. And then we know that we have to, the last step has to be feedback. Feedback to our students and to all other stakeholders. I'm sure we all, most of us at least, are very familiar about the Miller's Pyramid. And I will now request you to let me know what do you understand of these 4 steps. Knows how, shows, and does in the chat box, please. You may try and explain any one by naming it, or knows is recalling knowledge. I agree, yes. Levels of competency attainment may or may not be. Knows is what the examinee knows, yes. Recall facts. Shows is in a simulated environment or when the learner knows that he or she is being assessed. I completely agree, Suleiman. Knows how can explain. Yes, knows the rationale behind or at least have an understanding to explain it in his or her own words. A progression from knowledge to competency. Very good, Dr. Laikuzaman. If you move from knows to does, knows is basic knowledge, yes. Does is workplace-based assessment, may or may not be. This is now a contested statement, Dr. Mona. Now they place workplace-based assessments under shows because the learner knows that he or she is being assessed. Knows how is understanding. From knows to shows is classified as competence. Yes, very good, Suleiman. Knows how is application or understanding. Shows is how he demonstrates or does. And can he perform effectively in clinics is does. I completely agree. This is by Sabah. Sabah, thank you. Shows is performs under supervision. I agree. And shows how is not demonstration. Shows how, okay, right. And what is does then? So thank you for these responses and thank you for your interaction. I've really enjoyed and probably I've learned something more, something new. So we all know knows and knows how is mainly knowledge. Shows is performance under observation. The candidate or the learner knows that he or she is being observed or assessed, and does is in real life. And we have different assessment methods for these different steps. We have different methods for assessment of knowledge. We have different methods for shows, and workplace-based assessment is now classified as shows because the learner knows it happens in the real workplace. It may happen with real patients in real settings. However, the learner knows that he or she is being observed or assessed. And then there is does, when you are actually performing um, in your real life. Can we add to these competencies as well? I think if we break down does, if we break down this construct does, we will have different competencies. And that's what needs to be assessed at the does level, right? That's what I want you to reflect upon. So how many competencies or tasks or behaviors or performances we have been listing do we assess at the shows and at the does level? Is my question to you. Is my question to you to reflect upon. I know there are issues of feasibility. So if you allow me, this is how our assessments mostly are. We rely heavily on knows and knows how, some shows as OSCEs, and probably almost no does. It is negligible. I hope you agree to what am I saying. And now if you reflect upon what kind of an assessment program or plan does it look like to you?
We
Right.
assess the does level to the extent the way it occupies the smallest triangle at the top of this pyramid. It
Yes,
occupies the
or
least
maybe. And if you give me the liberty to reimagine or dream, this is how I believe approximately an assessment plan should look like. Remember the goal? The goal was to ensure that all graduates demonstrate competence, that they are competent. And I believe this is how our assessment plans or programs should look like. Any thoughts in the chat box around this one? Around this concept? Suleiman, thank you. There are issues of feasibility. And I am very, very glad to see that many of you agree to what I am saying. And I completely agree that there are issues of feasibility. And allow me to say this, that issues of feasibility should not supersede issues of validity. So when we have identified our learning outcomes, when we know what is competence for our graduates, is our assessment program or assessment plans produce valid outcomes as far as overall competence of graduates is concerned? So does really feasibility should drive how we determine and assess and certify competence of our graduates? Or do we need to make sure that our assessments are valid, move towards from the pyramid, which is on our left, and start taking steps to move towards the pyramid, which is on our right? Dr. Sarah, very important question. What would I choose, validity or reliability? Your assessments or assessment decisions cannot be valid if they are not reliable. So it's not a question of this or that. Reliability is a prerequisite for validity. If your assessments are not reliable, no matter how valid do they look, they are not valid. It's just a lottery. It's just tossing a coin. Yes, Dr. Suleiman, thank you. Validity encompasses reliability. Now, if you have agreed with what I'm saying, let me have the freedom to reimagine even further. And now I will share with you my dream about assessment. The dream is that the assessment plan should ensure or must ensure that the graduates are competent, that the graduates successfully demonstrate the range of abilities that enable them to perform all required tasks, competencies, outcomes, to practice effectively and consistently, to have valid and reliable measures with feasibility. And allow me to dream further. And I hope you will at least enjoy the dream with me. Imagine a medical college where we have good technology and artificial intelligence to help us make these assessments not only valid and reliable, however, feasible. So this is a hypothetical medical college with cameras and AI, which enable the faculty, the leadership, and the administrators to identify students as they enter the medical college, mark their attendance time in and time out, and continue to monitor these students as they wander around the campus, the classrooms, the laboratories, and the wards. Each of these students are also wearing smart watches. And these smart watches also capture or record or monitor or measure the sounds around, what they are saying. When they are talking to their colleagues, to their peers, taking histories, counseling, and doing communication with the teams. The same cameras and the watches continue to assess these students when they are in the labs, when they are in the wards, doing examination. So the faculty members are around. The faculty members are there. This is a simulation center, if you may have noticed. The faculty members are there to supervise, to give feedback, to educate, to train. However, the AI is helping making the process more feasible. The system, the AI system, knows what to assess, has been trained on all the competencies, and also have all the criteria for marking. The rubrics, the scoring criterias, the levels of performance are all available with the AI system. And the AI is continuously assessing, listening and watching, listening through their watches, and watching through the cameras, and assessing each of these students independently while they are in the wards, taking histories or doing procedures. The AI system then prepares feedback for students or performance reports as to how did they perform on each of the competencies against the class average or against the expectation. They not only get this kind of report, but they also get narrative reports through the system as to what did they do right and what do they have to improve upon. This is my dream. This is how I would like assessments to be transformed, so that the assessment of all competencies becomes feasible and valid and reliable. Yes, Maha, I will come to 360-degree assessment very soon. Thank you. My question to you, do you believe this dream can become a reality? A yes or a no? Let's do some poll on the chat box. Thank you, Dr. Mona. I will very soon talk about the ethics of it. Let's first talk about, can this become a reality? Can this become a reality soon? Yes, Dr. Suleiman, I agree. I like your answer, Dr. Mona. Big brother, maybe, but using artificial intelligence. So I want to give you two examples which are happening right now. We know that our laptops and our iPads sometimes some key uh, 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 locations give access based on if they recognize our faces, face recognition. I know of a school that's not a medical school, that's a K-12 school in Karachi, in Pakistan. There are cameras installed at the entrance of the school. Students belonging to grade 1 and grade 3 and grade 7 and grade 10, we know how they behave, how they crowd and rush and enjoy or run when they enter the school. So they don't have to show their faces to the camera. The cameras are equipped enough to recognize each student's face as they enter the school. They may be playing with their colleagues, they may be talking, hugging their colleagues, rushing, running, or just walking slowly. Each one of them, and this is happening today, is recognized, and their time in and attendance is marked, and a text message is sent to their family members that your child has entered the school. And the same happens when they exit. I also know of a college where students must carry their ID cards, and when they enter or exit, the ID cards uh, 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 make a note that they have entered and exited the campus. So let's come back to the cameras. So today, this is a reality. The cameras, while we roam around the corridors, while we enter or exit different spaces, be it cafeteria or ORs or libraries or labs, can recognize and track us. And recently, there is we know that there are a lot of research and a lot of literature available today using AI to score or mark student responses. We all know about it. This is becoming a reality. This has already become a reality. Recently, there is a research paper where they recorded students' interaction with patients in an OSCE exam. The recordings were transcribed using the system, the AI system. Their rubrics or their rating scales were also uploaded, and the AI system was trained. And they let the examiner score the students during the OSCE, and then they use the AI systems to score the students on their performances. And mind you, this was not examinations or clinical skills. This was only history taking, counseling, patient education, because as a first step, they just tried doing verbal recordings, oral recordings. And then they allowed the AI system to score the transcribed audio recordings. And they found the AI did a better job in terms of validity and reliability as compared to the examiners. So all this, the dream, the core teach, probably pushed me to have around assessments is becoming a reality bit by bit, step by step. However, there are again questions. There are questions about ethics. Can we have these cameras recording students' each move? Can we record everything the student says or does when they are in the campus or in the clinical spaces? At this moment today, can we really have rely on AI to have valid and reliable decisions? I think more research is coming out, which is supporting the notion that these artificial intelligence systems can produce valid and reliable results if they are trained enough on the tasks, on the criteria for scoring, but still we need to research further. And yes, it will make these assessments feasible. However, feasible in terms of cost to invest in technology is still a question. So these are points for us to ponder. It may not be a reality today. It may not be feasible for us today. However, believe me, it will become a reality tomorrow, and it will become feasible for all of us very, very soon. And we will have to debate and deliberate and come up with answers around the ethical issues. However, what can we do today? How can we start today to make sure when this technology is available and is cost effective, we are ready to adopt? And this is what I want to bring it to you so that we start taking small steps today. So as you all mentioned, assessment of all competencies is the issue is feasibility. But have we also done our homework to make it valid and reliable, regardless of feasibility? Are we prepared? Have we identified the competencies to be assessed? Is it enough teaching and learning and supervision and mentoring happening already for all these competencies? Do we have the assessment tools and rubrics and scoring criteria and performance levels available with us? Have we done our homework? Have we taken the initial steps which we should have taken already? Let me elaborate. So I think the practical steps for us, let us identify and define competency. For many of us, like for us in Pakistan Medical and Dental Council as a 7-star doctor have already identified these competencies for us and have defined them. CPSP have already defined the competencies for postgraduate education and have defined these competencies. The second step for us to either identify or adapt or develop assessment tools for these competencies. And I want you to reflect and identify at what stage and what step are we with regards to our programs, to our assessment plans, and what should be the next steps for us. And once we know we have the assessment tools, either identified from the literature or adapted or developed ourselves, we will have to have a plan as to when do we need these assessments to happen and where, in what settings, and how, and by whom. And somebody talked about 360-degree assessments, which mean even if we do not have the cameras and those smart watches, we do have a lot of people around who can help us do these assessments. The peers, the colleagues, the supervisors, the juniors, the seniors, other healthcare providers around us, the patients themselves. I know this is not feasible. Even at AKU, we tried and we failed. But trying is the first step, right? And then to ensure the readiness of all stakeholders. Are your examiners, are your raters trained? Are your students aware of the learning outcomes, the scoring criteria, and what and how to perform? Is there enough teaching and learning happening to support the assessment and the development of our students? And once you have reached this, we will first have to pilot and see if it is working. What are the gaps and improve upon, and then implement. And even after implementation, we will need continuous monitoring and improvement. So even when the technology becomes available and feasible to us, I think we will at least have to take the first few steps. Step number 1, 2, and 3, and 4. And this is what I would want you. This is my recommendation. This is my suggestion that we need to move towards in your curriculum committees, with your faculty members, in your assessment committees and groups. This is how we need to move forward. I brought at least a few examples of assessment methods or tools already available in the literature for different competencies. I'm sure you're aware of these. I'm sure you can just Google them and find them. And I know that this presentation and the YouTube recording will be available to you all. So my key recommendations before we close, please make sure we have identified the right assessment tool. If needed for our context, we adopt, we adapt, or we develop. It has to be contextually relevant and valid for our competencies and learning outcomes. We make sure we do multiple assessments using multiple assessors and multiple stakeholders, such as 360-degree assessment in different contexts and settings for different kinds of diseases. We have to ensure stakeholder readiness. And please do not forget feedback. I cannot emphasize this enough. You can see it on my slide. Feedback to our students and feedback to all stakeholders. Thank you. I would be happy to take any last questions. We have 4 minutes left. Any questions or comments in the chat box, please? I know Dr. Sara has also shared the feedback form. So we also need feedback. Yes. Dr. Sara, over to you.
Thank you, Naveed, for a wonderful session. I enjoyed it thoroughly and really want to be a part of your dream. Seriously,
Yes, I think we should all work together for this.
something I can relate to, something I've been speaking of. One thing I would stress is I have a dream for the faculty also. I want to identify the competencies, not for the students only, but for the faculty. What do you think makes a good teacher? We should train the faculty on those competencies and preferably assess them and give them feedback and make them good teachers. That is one area I think we need to work on a lot. I think I really want to have something to train the faculty to nurture these new graduates. What I feel is that our students need to be taught by someone who's equally competent and in the digital era as well. Many of us are lagging somewhere behind. Thank you once again, Naveed, for a wonderful talk.
It was a pleasure.
It was indeed a pleasure. I would like to engage you on a more of these events and would love if you could come to Lahore and do that in person.
Inshallah. Thank you so much for the invitation, and I would like to thank all the participants for their engagement and interaction. I think this would not have been possible without your engagement and without your interaction. So thank you so much for being such an engaging audience. Thank you.
Thank you all for being here and being with us. Thank you so much, Naveed. See you soon.
Allah Hafiz. Bye.
Allah Hafiz. Bye.